Hello everyone, a very warm welcome to Psych Talks. This is season 2, and we are super delighted to have two extremely important and say very important guests for us. They are actually they have we have few episodes with them in the previous session, and today we are going to have a discussion with them on the theme of Women's Day. So first of all, let me warmly welcome both the guests here. First is Dr. Abhirami. She is a homeopathic doctor and a psychologist, and she has an expertise in dealing with cases of infertility and other female problems and anxiety, depression, and all these cases. And the second guest here is Mr. Sai Shankar Kota. He is a engineer by profession, and he has turned into the wellness industry. Now he is a transformation coach working at Wellness Atlas. So a warm welcome to both of you. Thank you so much for your time and your presence here. It is much appreciated, and we are super excited to have you both here. And to start with, a warm welcome and happy Women's Day to all our viewers. So over to you, you guys. You can start briefly by giving any message, any startup theme for Women's Day. Dr. Abhirami, let's start. Begin with you.
Yes. Uh, Very warm welcome to all the ones who shared this, who is watching this right now. And first of all, I would like to wish everyone the happy Women's Day. Women's Day has been celebrating this much because the woman has a different phases in the life. Like men, uh, we don't have a completely a transaction of old, young, or pubertical phase. Not like that. Every phase is different. For example, pubertical phase where the child is growing to an adult. I mean, there's a transitional phase. And coming to the next phase, like reproductive phase and pregnancy, post pregnancy, and motherhood, then perimenopause, postmenopause, then old age. So every aspect of the phase has a different values. Which means they've been suffering with both emotional, it's not less suffering, but most both emotional and physical changes will be happening with each phases. Each can be influenced by the environmental factors, but also even without the environmental factors, it can also affect with the hormones. So every phases has a major role of hormones which is reflecting the both physical as well as mental phases. So we need to address the women as an individual and holistic as a person. So only if we understand the person as an individual, including the hormones, what they are going through, how they are exhibiting the symptoms, as well as how the environmental is influencing the symptoms. So I would like to especially thank Dr. Arshia for taking this topic in this particular event. In a Women's Day, because this is a right time to spoke about, like we have to speak about it, that every individual is going through the same pace, same changes, at maybe in a different paces, they may be in a different paces, but every individual is going through. So taken in a correct situation, correct topic, and correct day. And I would like to share the screen along with Mr. Sai Shankar. So he's also holistic practitioner who is also deals with the women as a holistic face. So we have to work on our individual as a holistic thing. So let us discuss things how we can approach holistic in the women and what are the things which is happening with the women in each phases. So that's how we go. We are going to do with today's session, I guess.
So, moving to Sai Shankar. So, what about what do you think is holistic care and how women can take care of their own self in an holistic manner? So, please share your insights about it.
Definitely. So first of all, happy Women's Day to all the women who has been attending and who all the women who has been taking care of their men in their lives, right? So basically, yes, basically, yes, the thing is, when it comes to women, so their work is not shown to the world, right? Maybe it can be just a homemaker at home, right? It's not just a homemaker, but yes, the men these days always thinks in the perspective, hey, what woman does if they are
That is
homemakers,
actually a
they're
tagline. She's just a homemaker. But what goes
right,
beyond it is not
This is
coming
a
in the spectrum.
correct,
that is the
right?
biggest job and task.
Yeah.
Exactly, exactly, right? So the thing is, I wanted to ask this one question in this basically holistic care. Like, how many women are actually eating on time? Is the first question that we have to ask today, right? So, kids, they have to take care of their kids, elders, all overall family, right? And she will be the last one to actually take care of herself, right? This is where the woman's health is actually going behind or falling behind, right? So, I feel it's not like woman has to take care, but men in the family has to support women, right? And also ask questions like, have you had your lunch first? Then you can, of course, feed us because your energy is the most important in the family to actually take care of all of us, right? But that is where everything falls. Correct. So as a transformation coach, I work on the root cause. So I always come to the root cause and actually point that out. So that's how I work. So that's one thing. That's the perspective I actually bring onto the table. That how the family is supporting the working woman or even the homemaker in the family, because it's not an easy job to actually take care of. But the thing is, with the emotional support, right? It is actually possible, right? So actually, it starts from the emotions in the family or from the family that comes to the woman that can actually build their health.
Okay, let's break down the age of women and the milestones achieved. So when we start a women's life, the basic thing after childhood comes the puberty. So my question is to Shai Shankar. See, we have many practices here. During the puberty age, people give raw eggs to women, saying that this will be a boost of nutrition in that age. So, is it really necessary, like doing these practices in the puberty age for nutritional benefit? Please shed some light on this.
Yeah. So when we talk about nutrition, so the thing is, are we getting the right nutrients through our regular food? Or the family in the girls, like who is getting into the puberty age, is the family is following a healthier lifestyle, right? That's the biggest question that we should ask them, right? If not, right, then at least the family should start like basically the girl's age in puberty will be like from 8 to 13, where they don't even understand what exactly the nutrition is. They just follow what exactly the family is doing or family is following. Correct. So the thing is how the family is building the lifestyle or maintaining the lifestyle for themselves, right? Are they having the knowledge about how they are taking care of themselves, or are they busy in their lives, not even taking care about what they are doing in their lives? Are they having proper sleep, proper food for themselves, right? All these basic things, if the family is following, automatically the girl in the family will automatically get those habits, right? So it is not needed that particularly that external nutrition is needed for the girl that age. It's not needed. Even through raw eggs is like one such thing that I wouldn't recommend. Because the thing is, the lifestyle that the family should be following is completely different. Then we can actually think of right nutrition that is needed at that particular age. Or else it is not needed. Even in the supplement form or these shortcut ways. I wouldn't recommend actually to go through these because that is not the age of actually going through supplements as well.
Okay, so over to you, Dr. Abhirami. My question is, what are the common ailments we come to know in puberty age? Because that is the period of transition of hormonal imbalances. So, in clinical practice, what cases do you see at the age of puberty? Because personally, I have seen many rise in cases of PCOS and all these things. So, what, according to you, is the rise in puberty?
This space, especially the I'm facing nowadays, like more of precocious puberty, like early puberty is around list of around age of 9, 10 to 11, 12, like that. So gradually we can say as 11, 12, or it's a little on the higher side, but still 9, 10 and all, it's like it's early puberty, and they started developing the PCOS sign in the early puberty itself. Secondly, delayed puberty, like even after 14, 15 years they are not getting the periods. That's the second thing. Also, I'm seeing acne, so much of acne, especially in the pubertal age groups. And PCOS, yes, insulin resistant because no physical activity, lack of stress, and I mean, lack of physical activity, stress, as well as like a improper diet. Whatever they are taking is more of junk. So that is also the reason. I mean, that also comes under a clinic where I'm seeing with PCOS and hair falls, their hormonal fluctuations, and they will see. I mean, they shows the symptoms of heavy menstrual bleeding, or it's like scanty menses, saying that one day I'm getting menses, thereafter there is no menses, and severe menstrual bleeding is also happening because of the hormonal fluctuation. And there will not be more of no annual sorry, we usually get a first initial phases of puberty. All the women usually gets annual ovulatory cycles. So annual ovulatory cycles, which has major role in for the delayed cycle, delayed I mean menses, as well as the delayed follow-up of next cycles. And apart from PCOS and acne, there are the PMS which is happening, like premenstrual symptoms, like either depression, anger, or crying without reason, anger without reason, or they themselves says like I'm depressed without reason, and crying outburst will be there, and anger with outburst will be there. So these kind of premenstrual symptoms, based on the symptom severity with homeopathy medicines, we have been addressing. And dysmenorrhea is another common symptom which is happening in pubertal age, as painful menstruation, based on the location of the pain, as well as how they are better with the pain. Then based on that we will be giving the medicines. So puberty is a phase where they are completely shifting their hormones towards the adult. It's a gradual shift will be there, but that it will be again like a zigzag pattern. So again, there will be identity crisis will be there in the particular period, whether I'm a child or an adult. So those kind of emotional variation also will be there. Also, there is a deficiency which is happening because there is no exposure of vitamin D. Also, since they are growing so much, there will be a calcium deficiency as well. So we need to check on the calcium levels as well as the anemia, I mean iron profiles as well. So, if they are going for a severe bleed, then we need to check with the hemoglobin level. Even sometimes, if there is a low level of hemoglobin, obviously they are going to get a scanty menses as well. Sometimes that will also cause us a severe bleeding. So these are the common symptoms which is been addressing. We have been addressing for the pubertal age group as of now, I guess.
Okay. Yeah, you're absolutely right.
Hmm.
So after the puberty age, there comes a period where the woman goes into, after education, she goes into work and workplace, and she experiences many kind of stress and all these things. So, what can be the strategies to manage stress and prioritize self care in that scenario? This question is first for Sai Shankar. I would like to know your perspective, how a woman can prioritize self care amidst these workplace politics and all workplace juggling.
Yes. So basically, what is happening today? So most of the women are actually sticking to desk jobs, right? That is where the activity has been very much reduced, right? So lack of movement, as Dr. Abhinami was speaking, right? So that is one of the things that has to build from childhood, I would say, because muscle is something that many women is not having these days. Muscle percentage in the body is something very much missing out, and at the same time, uh, self-care, right? So they have to prioritize themselves. It's like they should actually uh make a point of this is how much I would work and this is where I would stop. Is something that they have to come up with. But today, because of the industry, many people, not just women, even men, they work overtime. They're not prioritizing their health on top, right? So this is where everything is getting started. So self-care comes from understanding how my body is functioning, where my body is leading to, how am I feeling today? Is it just the point that am I only living for earning? Then that's the biggest mindset shift that the person has to make, right? But at the end of the day, that you should feel good about yourself. If that's the point many people are missing out, then that's where it should get started, right? So, for example, like my wife, Sharanya, like she used to work 16 hours in a day before we got married. And because of that, she was actually facing multiple gut health concerns, right? Constipation and migraine she entered into, and she got asthma, like breathlessness, and doctor has suggested her inhalers, right? Just for breathlessness, that too because of stress and anxiety, right? So after getting married, we understood okay how to prioritize work because if we work, they're of course gonna make us work. That's there because I personally been into software industry. I know how it is working right now today, right? But the thing is where to put full stop, right? How to deal with our own managers, right? Because at the end of the day, it's our life that we are putting risk, right? That's something that we always have to take care. And when it comes to stress, there is not the thing is we have to take breaks. I know it's sometimes we have to work overtime also, but the thing is where we are taking break is very much important. At least 1 to 2 minutes of deep breathing can actually help us reduce stress. The thing is we don't get that much time also. Someone in the family will come us, feed us, and then we eat on table and attend meetings. And that's where today's society is moving towards. And they are thinking it is normal, right? This is where the root causes are beginning from, right? So many people actually come to me after getting into disease mode or disease stage like PCOS or thyroid or insulin resistance, all these concerns after they are entering into maybe their yearly health checkup in office are actually revealing these things. They are not getting the test done by themselves also.
Yeah, that is a bonus for people
The
working in the industry.
IT corporates.
So this is how today's society is moving towards. But I would recommend the mindset shift. The thing is prioritizing your health on top of everything. So I would always give this example for whoever approached me, right? If you are sick for 1 day, just for 1 day because of cold fever, the first thing you will think of is to come out of that cold or fever. You won't think of your work also because you will be on bed when when this will cold come out of when this fever will actually give me relief. Then again after that we think of everything in the world again. Likewise, it's not just when you get sick, but even when you are normal, your first priority should be health. Then automatically everything falls around, right?
Exactly. So, Dr. Abhirami, here I can see that in this workplace and this working scenario, the cases of infertility are on rise. So, specifically in this generation, you see. So, what are your ideas about it? The rise of infertility in this generation and the causes behind it?
So basically, as I agree with Mr. Sai, so he says like we should have that limit. So we should also we should put a limit, and we should say no to no to beyond our limits. So when we are working beyond our limits, our sleep get disturbed first. Second, we will not have be that happiness like communicating mode completely rest going work, rest, going work, rest. It's not, there will be no space for ourselves. So there will be creation of stress, obviously. When the routine is, when you are following the routine continuously, that is again going to be creating a stress. So stress, sleeping pattern, which directly affects the female hormone as well as the men hormones. So here we are always talking about the female hormones for the infertility. There are men's 50% equally nowadays for the infertility because of their stress and as well as the hormone and imbalance, which is happening as same like a women. So majority of things are because of the stress and sleeping pattern as well as the food habits. So we can't say that the whatever we are getting is completely organic, or this is free from pesticides, or it doesn't contain something contagious. So though we wash multiple times, we don't know what we are getting from what. So from where we'll be receiving, I mean, we are receiving so many things from as a food, we are receiving something inside. So this can also fluctuate your hormones as well. So that is the biggest reason for the infertility, I guess. So we can wait it. Also, the other reason I can say is delayed. I mean, marriage, delayed planning of a pregnancy. This is also comes under infertility. But if they are trying after, I mean, trying for a year, and even after they are not going to get a conception, it's some. That's what we called as infertility. So if they are planning also, if planning delayed and the marriage is delayed even after the intercourse, so then that is also comes under infertility. So you have to plan accordingly when you are planning for pregnancy, as well as to take care of the child also. So if you're planning, that has to be done early. That's what I mean.
Exactly, you're right. So after a period of workplace, and working, then comes the period of pregnancy and its related, issues. So pregnancy is kind of a roller coaster experience where you face many issues, and after a long journey of 9 months, child is being delivered to the world. That is a whole new set of symptoms or whole new set of phase of life where motherhood begins. But at the same time, the female experiences something called as postpartum depression. Many women, some people are in mid phase, some people go to some extreme level. So, what according to you, Dr. Abhirami, are important things to be noted in postpartum depression, and how we can, you know, uh, keep ourselves aware of what is going to happen in the phase?
So in the postpartum depression, mostly two things which can affect a women. One is the financial need. Second is the emotional support. Predominantly, that is comes under the emotional support. Then there comes the financial needs. So both has to be planned priority. So if there is a emotional support, as mean even after delivery, after I mean the entire going through phase, you need someone emotionally or physically to be present. So so that only you can have someone. I mean, like you can take a rest, and you can spend some time for yourself. So you need some emotional support which has to be there, and financial planning has to be done earlier. So only then this kind of depression can be avoided in certain aspects. Even after a post, I mean, delivery, there are definitely going to be ups and downs with the hormones. When you're planned with the financial needs earlier, then that part is sorted out. When you are going with a only with emotional support, then you have to plan accordingly. The partner has to be stand for them. And those days there are we are in a joint family. When someone is there, the other one will be carrying, the other one will be taking care of the child. But now we are in a nuclear family. I mean, this is happening with everyone, because we are the parents are in somewhere, and we have to stand for our life. So that cases you have to plan it, and you have to plan for the emotional support and financial needs as well. And in case if you are going through so much, especially in the postpartum period, you need someone to vent it off. You want someone to say, I mean, you have to explain to them. So if you are not comfortable with the persons who are around, reach out with any psychologist or psychotherapist, so way they can help you. Or else if you want something for emotional needs or any physical disturbances, then medicine past has to be deal with. When they physically are not fit, obviously you're going with something emotional disturbance as well. So physically, if disturbance has been arising, so then we have to give something for the physical disturbance, so that which can be prevented further going to the emotional aspect. And apart from this, during a postpartum period, start journaling, start writing what you are going through. Secondly, have some physical activity. There is a period where we are very conscious about the body. The already there will be hormonal fluctuation so much, but still you'll be feeling inside that I'm very obese, I put on weight, how the image will be. So that will be also the added stress. So what we have to do is start working for ourselves. Breathing techniques has to be maintained, like you can have a simple pranayamas, simple meditations, simple stretching exercise. Spending time for yourself is maintained to manage these things. I want That's what I can tell this period.
Exactly. So here comes the next phase of body shaming, I would say, because after postpartum, like in the postpartum period, women tend to gain weight, and the first question that comes to them is, how do I lose that postpartum weight gain?
Mm.
So, Sai Shankar, my question is to you: that how does postpartum weight gain, and how to lose that kind of weight, and how much like effort is to be given in that area?
Right. So basically, like my point would be the first support should come from the family that it's okay, you will reduce your weight. The thing is, in today's world, there is mockery more than support, right? 90% of the
100%.
times, 90% of the times, it's mockery that comes into picture than support, right? So that's where like it's okay to be overweight for a certain period of time and you will gradually come back. And the thing is when it comes to postpartum weight gain, right? It's very normal for every individual, every woman, right? So the thing is how the pregnancy has happened. If it is natural, then of course they'll be able to like move faster, better. Even activity also can be started within 3 months of post pregnancy. That can also help. But the thing is, in the cases of C-section, right, after the surgery has happened, then of course they need more rest. They need more emotional support, as Dr. Abhirami was mentioning, right? The major missing is these things. In today's fast-paced world, we always focus on what needs to be done than what care has to be done. Right? I have work, I have to go to office. Only 15 days we are getting as men. But the thing is, women needs more support. Right? That emotional care is very much missing for me. And women are emotional beings rather than men. Men always think logical. Now your pain is gone, so I can go to office. The thing is, they need more emotional support than what pain they're actually going through. So this actually should start from the family itself. The care will actually move forward, right? And coming to postpartum weight loss, it's okay. Like it can take after 6 months or 9 months after post pregnancy. Also, they should start at least working on their weight if some surgery has already they have gone, right? But the thing is, no much activity should be done. Not high intensity workouts are not recommended in that period right away, right? And all the other aspects like food, they can start right away after their pregnancy. They can start eating healthy. There's nothing wrong in it. But today, what we are seeing is diet plan, and that is what's scaring most people outside,
People are
right?
sometimes offended, like they are obsessive having a diet plan. They come and tell us, give us diet plan for weight loss. We have PCOS, we have postpartum weight gain. Give us separate like entities for each one of them. They want it to be specific, and they are actually carried out by this marketing actually, like, which I have observed. They are very keen with this diet plans, and they are like obsessively going behind it without having the
Mhm.
thought of mindful eating and mindfulness. They just want to stick to the diet plans and then get most out of it.
And one
100%.
moreover, they need it in a particular duration, the shortest duration. They want to weight loss, then again there'll be weight gain.
Correct.
So
So
that's again a
many,
marketing. Yeah.
100%. So many people outside looking for shortcuts. They are not thinking of long-term health. Like after
Mm.
15 years, will I be able to maintain this weight if I follow this diet? So they start skipping meals, they won't eat dinner, they won't eat breakfast. So this is how the people are thinking of shortcuts, right? But the thing is sustainable health. How many postpartum women today can actually feed their kids with breast milk? The biggest question, and how many of them are actually using formula milk? Right? This is something the big that thought that actually came to me like the last few days, which I've been seeing outside. Right? So many people are feeding formula milk only because natural milk production has been reduced. Where maybe 15 to 20 years or 30 years back, this is not the case. Even with the 3 to 4 kids or 5 kids in the family, mother used to feed them with breastfeeding only. Right? That's how health is degrading today. Right? With right lifestyle habits, this can be done, this can be prevented. Even the kids' health can be of starting well, right? But many people are thinking shortcuts. As I'm a working professional, I should lose weight faster, I should be slim, I should be fit. So, what is the fastest way that I can lose weight? Give me a diet plan, right? So, I would always say if that's the mindset, I'm not the right person for to guide you, right? If someone thinks of sustainable health in the longer term, right, that's when the habits has to be shifted. The thought of how we are eating, as Dr. Arshia was mentioning, mindfulness. There's no mindfulness at all. Attending meetings and having food. We don't even know how much are we eating. Right? Many aspects comes into the picture. Sleep, how much sleep are we getting? How stressful are we and how are we managing it? How much activity are we including in throughout the day? Right? And this has to be guided by some professional. But people think I know everything. That's one of the things that actually leading them to many problems. Today I have Google, today I have ChatGPT,
Yeah.
right? And they think I gave all my symptoms and I'm getting solution and I'll try this. Trying is the biggest problem. The thing is you're not understanding your body. Only experts can understand it and guide you accordingly. But many people are missing this point out. And that's where health is actually degrading rather progressing in a positive step. Right? So, yes, when it comes to weight loss, you need guidance, but at the same time, if you are doing on your own, don't push your body so much. Give it its natural time and make the progress happen gradually in its own pace.
So now coming to the next phase where the woman is like after having postpartum, she again goes back to work and she has to manage both like work life balance has to come. Now in this scenario, burnout happens and that is the phase where women experience like emotional turmoils. So as Dr. Abhiram has already mentioned, we have to do journaling and all these things. The most common stigma that comes to play that is crying. So everyone says that crying is a weapon, crying is a tool for women with which they vent out their feelings and they get relaxed. Men are not crying, so they are, the vulnerable ones. So, Dr. Abhirami, do you really believe that crying is the best option for women, a best tool for women to vent out their feelings? And apart from this, what can other ways be effective for, venting out feelings and being into a place?
Okay. So, see, emotional, I mean, the way of conveying something when they are disturbed about is first thing is crying. So, why women tend to cry more is they have a relaxation after the crying. So, it's like a emotional detox. Crying is an emotional detox for them. So, allow them to cry first. Ask them what's bothering them. Ensure them that someone is there next to them. They need a support, especially when they are crying. that they don't need a solution for the cry. They actually need a support for the cry. Just be there and just listen to them, and for the crying. Apart from crying, is there any other ways like yes, we can ask them to have a certain breathing techniques, meditation, and speaking to someone else, as I mentioned. But if they are crying, allow them to cry. That's what my thing is. It's not something wrong. It's okay to cry. But keep on crying, 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 then brooding, crying, brooding, crying, brooding, then definitely they need to address with some medicines or some counseling is required for them. But someone has to listen to them. That's what it's good thing. Apart from crying, uh, other things like I mentioned, meditation, journaling, physical activity, going out, meeting people, that can also help. But allow them to cry, especially with the women.
So, Shankar, what do you suggest? How do you address women and their emotional well-being? Because emotional well-being also comes under holistic care. So, how do you suggest women for maintaining their emotional well-being?
Right. So basically, like if we talk about emotion in regular, right, not just like in postpartum situations, then see today how the situations are outside. So like women specifically doesn't have someone to vent out, right? Even if it's being in a family or even if they are not married yet, staying in PGs outside. Right, many kids I've been watching today, like around 20 to 25 years olds, right, who have been like staying in PGs outside. They go to work, they come out. The thing is, it became what became social life for them is going out to pubs, like enjoyment, and they are thinking that they are venting out. They are thinking that they are venting out things, but that's not how it should be. Even for men, it is the same, right? Weekend parties has become very much common today, right? There is no difference between man and woman in this particular scenario. And when it comes to like particularly IT industry, norms has become this, right? So you have to work 5 days in a week, and you can vent out the other 2 days, right? You can you they what is happening today is that particular things, right? But holistic care, but there is no like there is no support for women outside today who can actually help them understand what holistic care is. There are very few people, but the thing is, they are not going to them also. I am here to listen to you. Like even Sharanya, like we talk to our clients, right? So Sharanya always says, right? If you are someone emotional, you can always call me, talk to me. I'll listen to you, whatever is going on in your life. Because that is something every woman wants. Correct? But today, even this support, many women doesn't think that is right. Sharing my personal things for someone outside can also be difficult because today's world is negative and trusting someone also became very much tough. Correct? So that's something that emotional help is needed for every individual outside. Even if it's a care that is needed, right? Maybe the experts like you guys, people has to at least come to you, understand things, right? And share the things what is actually going in their heads, basically. And that is not happening. And they think if I watch some movie, if I watch some drama, it is sorted. But it's actually deep root. It is actually getting deep rooted inside, and that's actually leading to many other hormonal health concerns. Actually, PCOS, infertility, all these cases are starting from the root cause is like where they are not able to emotionally vent out their what exactly is happening in their lives, right? All these are starting from the root cause only. But again, when they are approaching experts, after some problem is actually happening, or my periods are not happening for last 3 months or 6 months now, or it is continuous, like from last 6 months it is not stopping only, right? So we have been handling so many cases, but people approached us before 2 to 3 years when the actual concern happened. But they got started with the program after 2 to 3 years when the problem actually came onto the picture, onto the world, right? The thing is, fixing the root cause where the emotional help is needed, then they should openly go and talk to someone before it turn into something very big, right? So that's what I would personally suggest.
One more thing is, no one is there to trust now. I agree that we are with him also, that no one is there to trust and listen for them. So they have started doing with the chat GBT and
Exactly.
AIS. They have started with trusting it.
They have trust issues. They feel that they'll be not, no, they don't feel that some insider kind of vibes, and they try to rely on social media and chat GPT
Yes.
rather than
Yes.
believing on humans. Exactly.
Or anonymous messages.
Yeah. So now moving on to the next stage of life is somewhere where woman reaches menopause. She goes through the entire different phase of life where she is coming to an end of her reproductivity to say. So that is some a phase where she becomes rough. She has mood swings and all these things. So my question is first to Sai Shankar, how do you address women of that age, menopausal age, and how do you ask them or suggest them what things they can do to get rid of menopausal symptoms without medication? Because that is a main concern of women in that age. People are like they are more concerned of going to someone, a health coach or a doctor, with less medication because they are very frustrated with all these symptoms handling in that scenario, so that they want something to be medicine free. So, what is your insight about it?
The major problem why exactly the perimenopause, like postmenopausal stage is becoming difficult for women is the muscle percentage in their bodies.
Mm.
Already there is very less muscle percentage that has been observed rather like compared to men, right? But right after the age of 30 today, like in today's generation, from the age of 30, every year 1% of muscle will be reduced. So it will be reduced, and if you're not taking care of it, if you're not working on your strength, if you're not working on your muscle maintenance, then it is going to become very much troublesome when if it is when you come into or enter into perimenopausal or postmenopausal phases. Right? It is like what we have been observing. It is even becoming difficult for women to walk, just walk. Right? So such scenarios we have been observing today. The thing is, there is no one actually to care. Again, there is no one actually to tell that your health is also important. You should also go out, work out, meet people, talk to someone, make community, build a right people around you. There's no one to talk about this for women. How men are socializing, even if it is in 30s also, 40s also, 50s also, they go out, find some person, talk to them, they build friends so easily, right? But there is no time for women to go actually out and talk to someone or build such circle. Today, many people are living in many big communities, right? Many big communities where there are thousands and thousands of people. Where I personally see men have many groups. One is badminton group, one is cricket group, one is many groups like that, right? But whereas when it's coming to women, there are no such groups existing because they have to make things ready for family. They have to make arrange, and everything that has to be done is by women only. And very few men and very small percentage of men are actually understanding this and supporting in this cause, right? So it has to start from the age where the problem doesn't started yet. But people today always thinks of, okay, I got this problem, then now I have to fix it, right? So if you ask this particular question after postmenopausal, how to actually take care, so many hormonal fluctuations are going to happen, right? And it is normal, like how we actually address post pregnancy symptoms. In the similar fashion, we have to address these also, right? So it's my mom today who is in postmenopausal symptomatic stage, right? So there should be someone, like my dad is completely busy, so there should be someone for her to speak out or share her thoughts or share her emotions with. I'll call her, I'll talk to her, and she feels better. And that's what gives her emotional strength and do more work. Go out, do more work. Right? So, and one more thing, what I have been observing is post-menopause is happening very early. Like menopause is happening very early. Right? In early 40s, doctors are declaring you're in post-menopause, like you're in menopause stage. And that's the reason you are seeing these symptoms. But it's not. Earlier, it's in 50s, mid 50s, early 50s and mid 50s and even late 50s also. But why this is happening today this early? Because all of us are actually sticking to our seats, not moving, very less movement, overall lifestyle has been degraded. Even the food, what Dr. Abhirami was speaking, right? Food quality has been completely gone. There's no nutrition only in the food. How will our body support us in such cases? Correct? So such things has to be addressed early, right? And even after that, even in postmenopausal, if someone is facing such things, so what we suggest personally is blood report, complete blood work has to be done. At the same time, right nutrition support has to be given, and slow movement, what they can do in that particular stage. Right from there, everything the lifestyle changes has to be started, and right support. We also talk to the men in the family that you have to do this, or else it'll become very tough or a burden for women in that age. Correct. So this is something that has to be addressed whole as a family rather than just thinking as a postmenopausal woman.
Now over to you, Abhirami. Because in menopausal age, the risk of osteoporosis is more. So the concern rises here is calcium supplement really necessary in that age to be taken regularly, or what can be done for that, stabilizing that issue?
See, first, post-menopausal, obviously, calcium levels will be, I mean, in the lower phase or is gradually in the declining phase. So first, check with the calcium levels. Not every woman needs to be taken calcium because taking calcium is also again going to be overload if it is more. If the calcium levels are normal, then why need to take the calcium supplements? And check the vitamin D levels as well as calcium levels first. If there is a deficiency, then go for a supplements. Predominantly, rather than calcium deficiency, the major deficiency is vitamin D. People are being not exposing to the sunlight, so definitely they need a vitamin D supplements if there are vitamin deficiencies there. So we need to see first if there is a deficiency, they can go for it. Secondly, first ask them to do the DEXA scan. They need to see how intensity of depletion of calcium is happening in the bone, how the bone is there. Is it comes under the osteopenia or osteoporosis? So they generally have an idea at what point they are. So how aged their bone is. Before entering into the calcium supplements, start with the proteins. Good amount of proteins and building muscle mass will definitely help the bone strengthening. So start with the muscle mass. So to create the muscle mass, they need and an average 0.8 grams per day of protein according to the weight. So 1 kg for 1 kg, they need 0.8 grams and an average. So they have to take it. The protein substance they have to be incorporated. Then muscle strengthening has to be done. Then we need to check with the calcium levels. Calcium levels, if deficiency and risk of osteoporosis and severe osteopenia is there, then go for it. If not, then wait. We can give a supplements as such. Taken the supplements of in homeopathy, we can giving supplements like biochemics. We have been giving it for the same. Not regular calcium supplements required if there is no deficiency.
Exactly. So coming to the end of the phases of women's life, in general, when I personally come across any female, I will give more emphasis to the root cause of the illness, because that is the basis of homeopathy, how we
Yes.
treating the root cause first. So, as a general advice, what would you suggest, Sai Shankar, if you are going to give a general advice to women seeking holistic care?
So one liner it is, so prioritize. So prioritize yourself first. Then the whole family will be taken care. Right? So if your health is good, then whole family runs very smoothly. Correct? So that's one thing that women are missing out. They prioritize everyone else first, right? And they have to take care of everyone else first, then their priority comes. That's something the biggest miss out. I don't know who created these rules, right? But that is how it is happening today, right? They are not
I think
eating
that
on
has
time.
come from generations actually, because women were given a side position. They treated it as a norm, societal norm, and that has been cultured into our generation. It has been cultured into our tradition actually.
True. Right? So that's where everything begins. Prioritize yourself for your own health first, then automatically your family will be well and good in your hands. Because if you are healthy, whatever you are eating, whatever you are doing, automatically your family also does it. Automatically your family will also be healthier along with you. So that's something I would actually add.
So, Dr. Abhirami, I would like your inputs about how homeopathy can help women in every stage of life, and your final word about Women's Day. A special message to all women out there.
Yes. So homeopathy, how we have been dealing is based on the symptom similarity. So whatever the diagnosis is, whatever if there could be everything in the normal in the report, but still they have a symptoms, then definitely we could have take up the case based on the symptom similarity. So we don't bother about the diagnosis as much as big as it is. So we based on the symptom similarity, will take it off, especially with in case of anxiety, what type of anxiety, what type of how they're exhibiting anxiety, how is the cycle flow, how is the flow of how many changes are there, and any pain in sense, how is the how what makes better and what makes worse. So this kind of symptoms, as well as uncommon peculiar symptoms, especially they'll say like there's something is there stuck in my throat, there is a difficulty in swallowing something in there in my throat. So this kind of sensations and uncommon peculiar symptoms which help us to get the selection of the remedy. So even if you are not getting or a point of a unknown diagnosis, or without any medications or anything which doesn't helps you, at one point of time you can reach any of the any homeopathy doctor who can treat you, because we have been treating simply, we say simple similarity, symptom similarity. As a take home message of Women's Day, I would like to say all the women, stay independent. The empowerment of women is based on the financial stability. Once you have the uh, strength in your spending your expenditures, spending your own money, there comes a woman empowerment. Secondly, you should be self sufficient and self confident and satisfaction. So every pace is going to be a different level of stress levels, different stress levels, different exposure, different responsibilities. Everything is going to be there. But end of the day, you should be there for yourself. You should be satisfied for yourself. You should be stand for yourself. So no one is going to be stand for you until you are doing for the same. So stand for yourself. Be self-sufficient. Be self-independent. That is how the real empowerment is. Take care. Happy Women's Day.
Exactly, really like agreeing with you. So, with this, we have come to the end of the session. Thank you, both of you. Your inputs and insights are really important to us, and I guess the viewers who are watching this, they'll be enlightened to know how holistic care and homeopathy can come hand in hand, and how all these things play a role in our lives. So, with this, thank you. And this is Dr. Arshia signing off from Psych Talks. Stay tuned for more sessions with us. Thank
Thank
you.
you, Dr. Ashia.
Thank
Thank
you.
you.
Thank
Thank you,
you.
Sai
Thank
Sai.
Shankar.
you.
Sai.
Thank you, Abhinavi.
Thank you.